have to understand that yes, we have a lot of bad news which is associated with COVID-19, but let me get in with some good news to begin with. We've all heard about the H1N1 epidemic which happened 10 years ago, and that had a lot of patients, pregnant patients who were affected. Around 4% of pregnant women were actually admitted because of H1N1 infection, and around 6% of deaths which were reported were because of H1N1 in pregnancy. To conclude with that, we can say that we can say that the COVID-19 in pregnancy has been very beneficial and very good to us. COVID-19 in pregnancy, yes, there are a lot of myths surrounding it. So today we break on with it, and I'll touch on some important aspects which I've prepared for you that we can clear out certain doubts which are there for you. So, does COVID-19 increase the risk of issues in pregnancy? Ideally, no. COVID-19 and pregnancy has given us something which is very good because compared to the general population, the risk for a pregnant female is equal. There's nothing which is have to be worried about. But then, yes, the side effects, if we have any complications which are associated in pregnancy because of COVID-19, that is something which has to be worried about. So when we look into it, the major issues which happen with COVID-19 are actually similar to what happens with any other random patient or any other random person. The risks which are there, which happen, is basically when you start developing symptoms because of COVID-19. And the symptoms are more or less similar. You might have fever, you might have cough, you might have stuffy nose, runny nose, or you might have chest pain or breathlessness. These are the basic symptoms which warn you that you might be infected with COVID-19. And that is where you step in and get a COVID-19 RT-PCR done. That is the mainstay of treatment. So now we come to what happens when you get COVID-19 in pregnancy. Before that, let's start with what happens when you're planning for a baby. If you're planning for a baby and if you get COVID-19, well, there's nothing to be worried about. Major thing which you should understand is COVID-19 actually doesn't affect your fertility. And you have to be vaccinated. Vaccination becomes very important. As and when I move throughout the presentation, I'll be telling you different levels at which you should have a vaccine be vaccinated. So when we come to COVID-19 and pre-pregnancy counseling or the counseling which happens before pregnancy, that is the time you get a vaccination done properly. And then you move on with your pregnancy once you get pregnant. So when you're pregnant, there are different trimesters which we discuss about. Trimesters basically first trimester, second trimester, and third trimester. In first trimester, basically the first 12 to 13 weeks, what happens if you get pregnancy and COVID? Well, ideally, no complications have been reported when you are pregnant and you have COVID-19 during any of the trimesters. This is something which you should understand. There are risks which are associated, which I'll break it down again, but major risks are involved when you have high-grade fever and pregnancy. High-grade fever itself has incidences that it leads to miscarriages. This is something which you should be worried about, and that is why you see a doctor. Over the entire trimesters, as per the government, we have decided that we go in with a systemic checkup, which happens with your doctor, which is the ANC checkup. We have curbed down the number of visits which we can do for a patient. On that, we majorly concentrate upon the important aspects where you should meet a doctor. Supposedly, you're in your first trimester, get a proper screening and a sonography and the dual marker, which happens at around 12 weeks. In the first half, if you have any doubts, get in touch with your doctor, which can be done either through WhatsApp or it can be done either through telecommunication or can be over the phone. Depends how tech savvy your doctor is. If something requires an admission or requires you to see a doctor immediately, report to your doctor and you can visit a nearby hospital facility. Then moving on to the second trimester, these have certain investigations which are mandatory. As in the 20 weeks, anomaly scan, the 18 to 20 week, which is done roughly depending upon your gynecologist, you decide on that and you do a investigation, do a sonography, and you meet your gynecologist then. Accordingly, then you move on to the 26, 28 week mark. That time you can again do a sonography and a basic investigation list, and you meet your doctor. At around 32 to 36 weeks, you do a sonography and the basic follow-up which happens with the doctor, and you meet your doctor. And finally comes the later half of the pregnancy. That's the third trimester just before the delivery. This forms the important aspect when you have to meet your doctor quite frequently. That time, An NST has to be scheduled for you as per whatever weeks you are in, and then you have a sonography routine which happens accordingly to your doctor's advice. Now comes in what do you do if you have COVID in pregnancy in any of the trimesters. When you are reported to be COVID positive, there are certain group of investigations which you are advised. Basically, the basic CBC, the CRP, the interleukin 6, the D dimers, the LDH. These are the important investigations which relay how important or how bad the COVID infection is for you. Obviously, CT scan is something which is not advised, but an X ray can be done if you have any respiratory symptoms with a shield around your tummy. So, again, coming out to these important things, this is something which is just the basic thing which comes in. Now, I have certain questions which I have prepared for you. Basically, the doubts which I get from patients, those are the aspects which I'll be turning out. Can you travel during pregnancy? Obviously, no. Pregnancy and COVID times, it's difficult you want to travel during pregnancy with the COVID around. Your home is your basic safety thing which you can have around. Traveling itself, see, traveling by a car is okay. But with pregnancy, you have different issues which come in. You might want to take a loo break very frequently. Where will you stop? So those things become a difficulty. Again, make your surroundings such that people around you are protected. Like you have the IPL bubble which sets in, you can have a bubble around your home. Make sure that everyone is vaccinated around you. Avoid a lot of visitors, avoid a lot of relatives who can come and meet you, and restrict it to just the family members who are there around you. Avoid the wedding seasons, which is a boom, which is right now. Avoid going to weddings and just mixing up with people. Then reach out whenever you're reaching out to a doctor, make sure that you tell the doctor proper history. You tend to miss out or you tend to not talk about whether you have fever, thinking that the doctor might not see you. But then these things become important. See, you have to understand that if you turn out to be positive, you might actually pass on that infection to the other healthcare workers who are there for you, who are working for you. So if you have any symptoms in and around family, then talk about it. Tell your doctor about it honestly, that at least they can take the necessary precautions which are required and plus advise you or guide you properly. Next, in what happens in ANC, your exercise, your diet, your planning of labor, whatever happens during the entire pregnancy, that should not stop. Exercise, yes, you might not actually have access to walking around in your society, then do it at home. We have a lot of ANC classes which happen at online. So register on that and you can continue with your exercises. You should not miss out on those aspects which help you actually to have a safe pregnancy. Again, diet becomes important. Since you're at home, you have the access to proper balanced diet. Get on with it. Consult a nutritionist, consult a dietitian so that you have a proper diet plan which is followed on, and everything can be done online. Planning for a baby, planning for a labor, all these preparations can start in at home itself. With the father being at home most of the time, being work at home, you can actually have a good time to spend with the father, and they can actually together plan out the pregnancy and the things which move on with it. Vaccination, yes, there has been a lot of controversy related to the vaccination. Well, for US, they have a benefit. They have the Pfizer and the Moderna, and they have statistics and papers which prove that they have been safe. In India, we don't have that many papers. But as per the FOXY or the Federation of Gynec Society of India, we have got a green signal. Therefore, vaccination happens, but do discuss with your gynecologist when you have to take it. Again, like I already pointed out, that you have to visit a doctor at as per the frequency, as per the intervals. But if you have a high risk pregnancy, the number of visits might change. So you consider that aspect too. Then comes the important part. What happens if you are into labor? Basically, again, we classify pregnancy in labor between three groups. You're normal, you don't have any symptoms, that's a normal pregnancy, normal patient. Secondly, you have a COVID suspect patient, wherein if you have come in contact with a suspect, or whether you are a suspect yourself with symptoms. And the third part is if you are pregnant with COVID. Everything has a different management. So, if you are pregnant and you have COVID and you're ready for a delivery, so this doesn't see COVID-19 doesn't affect the mode of delivery. If you are bound to deliver vaginally, then you will deliver vaginally. COVID-19 is not the indication that you will have a cesarean. There might be other conditions wherein which demand that you have to go in for a cesarean, then that's defined by the obstetrician. But just in case if you have COVID and you have to deliver via cesarean, that's not the indication itself. Again, COVID-19 has led to a lot of preterm deliveries. That's an iatrogenic or a doctor decided preterm deliveries because there are complications which are associated with it. You might have high grade fever, respiratory compromise, your levels becoming haywire, and that moment might require you to deliver preterm. If during a preterm delivery, that is completion, before the completion of 9 months, if you plan to have a delivery, and if your doctor insists on giving you a steroid injection, then that is completely safe. Now comes the management part. Just in case if you have COVID during pregnancy, there are a lot of medications which are advised. You should know that there are few medications which you're not supposed to take. The newest one being the molnupiravir, that is absolute contraindication during pregnancy and even if you're planning for a baby. Otherwise, the azithromycin and doxy is also contraindicated, which you should not take it directly without the indication or without the advice of your gynecologist. Then now we come on to the delivery aspect. If you're ready for a delivery and the doctor decides that you have to go in for an induction of labor, if it's an indicated induction of labor or an indicated elective cesarean section, then obviously the doctor moves ahead with it and there's no contraindication to say that that's not required. If you have a planned cesarean or a planned delivery, again, I'm retiring, that you can actually go in for it. Now comes in if you're actually moving into labor, your people around you, we actually advise only one attendant who can be present and has to be COVID negative. And there should be no mixing of attendants. No relatives are allowed during the time of delivery. The doctors around you will take utmost precaution, the utmost necessary care which is required during your delivery. All the necessary investigations which are required to be run, they'll be run around, and they'll see to it that your pregnancy and your delivery is uncomplicated. Now we last come to the breastfeeding aspect and what happens post delivery. So once the baby is born, what do you do? Breastfeeding, yes or no? Breastfeeding, whatever statistics which we have, it is seen that breastfeeding the baby actually doesn't harm the baby. So you can obviously move on with breastfeeding, but few things which have to be taken into consideration even now. That is, the mother has to wear a mask, a three-ply mask, and has to sanitize her hands whenever she is breastfeeding the baby. If not, what other option which we have? The mother can actually express the breast milk and keep it aside for someone who is COVID negative to feed the baby. These things have to be taken into concern. Vaccination during breastfeeding, again, it's proven to be safe and can be done, but then discuss with your pediatrician once and your gynecologist once again so that you are not into certain contraindicated category. A few aspects which become important is that epidural, yes or no? Well, there's no contraindication of taking an epidural analgesia during delivery. Epidural or spinal anesthesia, whichever your doctor recommends, is actually yes, you can go in for it. General anesthesia, yes, not very advisable. But if you have a respiratory depression, which makes it difficult for you to have a normal delivery and you have to move in for a cesarean, general anesthesia can be given. One thing which is not advised during COVID times is the laughing gas or the nitrous oxide because the safety and the surety of the cleaning of the mask is a doubtful thing. So that is something which has been restricted. Otherwise, the epidural is something, yes, definitely a person can go on for. Apart from that, any painkillers during pregnancy, everything can be taken. The basic dolo can be taken. Apart from that, NSAIDs or the Brufen, those are absolutely not contraindicated. And a few important things you should know that the breast milk, the amniotic fluid, whatever tests have been done, they actually have not showed any traces of COVID-19 virus in the amniotic fluid or the breast milk. So that's becoming a very good news for anyone who's listening to. Well, that's it then. Vaccination I've covered, the important things I've covered. If anyone has any question, can go ahead with it. I'll wait for a few more minutes to see for any questions or if any important point which I think which needs to be important. So I have one question. Can COVID-19 infection cause preterm birth? Well, like I said, preterm birth per se is not because of COVID-19 leading to preterm, but there are other complications which happen along with that. Supposedly, if you have a COVID-19 which is worsening, which affects your which leads to respiratory depression, or which leads to any derangement of your coagulation profile, the D dimer levels, which I already spoke to you about, then that can be something which can make a doctor make your gynecologist decide that you need to go in for a delivery. But again, that is to be done with a multidisciplinary setup. It has to be done in a proper institution where things are managed. That's it then. Does COVID 19 infection cause miscarriage? Well, ideally, no. There are no reports of COVID 19 infection causing miscarriages. The fever, which is there, a high grade fever because of COVID 19, that itself can lead to miscarriages, but per se, COVID 19 does not lead to any miscarriages. Another question which we have in, can pregnant people pass COVID 19 to their fetus during pregnancy? Okay, so this is called vertical transmission. Vertical transmission is something wherein the infection can happen from the mother to the baby inside the uterus. Ideally, there have been no studies which reflect that a vertical transmission can happen. Even if you're COVID positive and you're delivering vaginally, the risk of baby catching catching an infection is very less. And if you have a baby who is born to a COVID 19 mother, just follow the basic COVID protocols wherein the baby is bound to be a suspect. So the baby has to be tested and the baby has to be isolated from other healthy babies. Like I already pointed out, that breastfeeding can be done. So another question, I am pregnant and I have a new fever, probably new onset fever, cough and headache. Could this be COVID-19? So there's something which we follow. Any fever during this pandemic is supposed to be COVID-19 unless and until proved otherwise. So if you have fever, cough and headache, go in for a COVID RT-PCR test. Rather than the rapid antigen test, always move on for the COVID RT-PCR test. Also, see for any symptoms which are there for your nearby people, your husband, your family members. It can be negative and it can be because of seasonal flu, which also happens. But being a pandemic, never rule out COVID 19 infection. Next question. I have heard that some prenatal care visits will be virtual. How will my pregnancy be monitored for complications? Exactly. This is something which I was stressing about. So, as per the guidelines decided by the WHO, decided by the American College of Obstetric and Gynec, the Indian College, which is the ICMR, and the Safe Motherhood and Childhood Planning Committee, we have decided that there are few investigation and few visits with a doctor which has to be mandatory. This is the first trimester, which I already specified, the 12 weeks, one visit between the 18 to 20 weeks, one visit between the 24 to 26, one around the 30 to 34 weeks, and then following the 36 weeks onwards. So your gynecologist already will have certain idea regarding if you are developing any complications. And if there is something which just shoots up, which you are unaware about, always feel free to contact a doctor via telemedicine or the teleconsultation which happens, or a WhatsApp or a phone call. If something needs to be evaluated, then you can just visit your nearby hospital. But otherwise, these are the important visits which should not be missed out on. Rest, it will just follow in. Don't worry on that. Your monitoring will be done with your gynecologist. Doctors are experienced enough to know what to look out for as and when the pregnancy goes on for. Do we have any more questions? So I have heard that some hospitals are testing all pregnant people for COVID-19 who arrive to the hospital for labor, even people without any symptoms. Yes, so Hinduja Hospital, where I am associated with PD Hinduja Hospital, Khar, we have a non-COVID protocol. We do not actually admit COVID-19 patients. So any patient who comes in, even asymptomatic, we have a protocol which we maintain. Supposedly, even if you come in labor or even without being a pregnant patient with any other symptoms, supposedly if you have a spotting which happens or excessive vomiting, we test all the patients who come in with contact with us. We check whether they are COVID-19 negative. The RT-PCR is done, the rapid antigen is done. If you are negative, then we actually have a protocol of admitting. But if not, even if you need certain urgent management, that will be done. You have to understand that we do not refuse any treatment whatsoever. No doctor actually refuses any treatment whatsoever. All your treatment will be done. But this is, you have to understand, for the basic safety of the people around. If you have people who are actually asymptomatic and you're coming to a hospital, we have to make sure that the people around you are also negative. So that gives A, you don't spread the infection to the patient around. B, you are assured that if the patient is admitted next to you and is that patient is COVID negative. That is something which we do for protection of you and also the healthcare workers around you. Next question. I have heard that hospitals are restricting visitors. Will I be allowed to bring a support person with me for labor and postpartum stay? Yes, definitely. So we are restricting visitors, but then again, you have to understand that it's restricting not visitor, but visitors. Your husband, definitely, you can have him around during your delivery and during your postpartum. And the husband has to be asymptomatic and has to have a proper testing and the doses of vaccination covered also. If you're getting a jhapa, which most frequently we have patients getting in around, that person also has to be vaccinated and that person also has to be tested for being COVID-19 negative. Make sure that you don't start changing, or make sure that the person who comes to visit you stays throughout during the entire stay, and you can't be changing the visitors or the relatives around you. Next question is, if I develop COVID-19, will I still be able to breastfeed? Definitely, yes. This is what I was telling about. So, COVID-19 and breastfeeding, there's actually no contraindication. There are a few things which you should understand if you are a breastfeeding mother. A, if you're breastfeeding, then the baby, when you're breastfeeding the baby, you actually have to wear a proper mask, a three-ply mask or an N95 mask, and you have to sanitize your hands before breastfeeding. Once the baby is breastfed, the baby has to kept at least 6 feet distance apart from you, or you can breast express the breast milk and ask someone else who can breastfeed the baby who is COVID-19 negative. This also can be done. Breast milk has shown no traces of COVID-19 infection, so yes, breastfeeding should be done ideally. Is it safe to deliver my baby in a hospital now? Definitely. Where else will you deliver? Baby has to be delivered in the hospital. Visit a hospital, find out the protocols which are there with the hospital, which they have laid down for COVID-19, and accordingly you can figure out what protocols you need to follow for the same. Can COVID 19 cause problems for a woman's pregnancy or a baby? Well, per se, COVID 19 has led to a little bit of issues during the entire pregnancy, like I already pointed out. If you understand, pregnancy is a hypercoagulable state wherein your blood can become a little thick. That is a normal situation which happens in pregnancy. But if you have COVID 19, that increases the risk of hypercoagulability. Therefore, that itself can lead to a lot of symptoms in the pregnancy for a mother. Apart from that, the respiratory issues which develop during the pregnancy, that is detrimental. So your gynecologist or a doctor will rule out all these possibilities, might start you on a blood thinner which has to continue throughout the pregnancy, and will be doing a specific sonography wherein they do the sonography for the baby along with testing the blood flow to the baby. This is done by something which is called as the color Doppler for the baby. This basically is something prophylactic which is done to rule out any complication which can happen therein. Apart from that, if you have COVID-19 during pregnancy, healthcare workers will take utmost precaution to not have lead to any complication which can happen later on. But overall, like I said, pregnancy and COVID-19 has been something which is good, and our pregnant patients have not shown very bad effects with COVID-19 infection. And the last question for now is, do pregnant women have higher chances of getting COVID-19? No, pregnant women are at the same risk as any woman who is in the same age group and around you. But the only thing is, if you have any complications during pregnancy because of COVID, that complication can be a little worse for you as compared to any person around you. That is why the stress upon COVID-19 and the pregnancy, and that is why the talk which happens today. I guess that's the last question for today. Thank you for everyone who has joined in. I hope this talk helps you in a lot of way. Again, just reiterating whatever we have spoken about, COVID-19 in pregnancy, being pregnant doesn't increases the risk for you, but obviously the risk if you have COVID-19 in pregnancy can be a little harmful. Apart from that, vaccination in pregnancy, just discuss with your gynecologist whatever the gynec has to say. The Federation of Obstetric Gynec Society of India has given a green signal that you can be vaccinated during pregnancy and breastfeeding. So go ahead with that. pregnancy and COVID-19, just discuss with your doctor whatever investigation and whatever visits have to be scheduled, and accordingly, you meet your doctor. Labor, decide with the hospital whichever protocols they have to follow, and accordingly, the delivery happens. COVID-19 doesn't lead to cesarean always. The method of delivery is decided by your doctor. There's no harm during breastfeeding the baby. There's no harm during being with the baby around. And once you become asymptomatic, you can just continue being as you are always. Guess that's all I have for you. Just be strong, be safe, and follow the general guidelines, which are more important. Stay safe, wear a mask properly, get yourself tested if you have any COVID-19 symptoms, and just do a proper follow up with your gynac. Just reach out to your gynac, be considerate, be honest with your symptoms, and let us take good care of you. Thank you then. It was nice talking to all of you. Goodbye. Take care.